Hello friends, welcome back to the healthcare today. Today we are going to speak about fluid in the lungs, also called as pleural effusion. What happens when there is fluid in the lung? So what should we do? Once there is fluid in the lung, normally fluid will be there in the lung, around 20 to 25 ml of fluid will be there at any point of time, and every day 3 liters of fluid is generated inside the body and also it will be absorbed. So at any point of time, if you look at the lung, only 20-25 ml of fluid is left. So what happens when this fluid is getting accumulated inside? So once we know that you are having fluid inside the lung, what we tend to do is we tend to remove the fluid and check whether it is infective or non-infective. So broadly speaking, what are the infective causes? Once we talk about infection, the most common infection which we see is tuberculosis. So once we are suspecting tuberculosis, what is the typical presentation of the patient? Patient has low grade fever in the evening, patient tends to lose weight, and also patients have right sided chest pain, especially the pain aggravates on taking deep breath, coughing and speaking. This is a hint that there is a fluid inside, and once we do the x-ray, once we find out that there is a fluid, we tend to remove the fluid and send it for analysis. And the other infections like bacterial infections, what happens when there is fluid due to bacterial infections? Usually when there is tubercular effusion, the history is slightly larger. You see patients having cough, fever for 2 to 3 weeks. But in case of bacterial infections, the history is very short. You have high grade fever, especially people complain of fever of around 102, 103, and the history is very short. They present to you within 3 to 5 days. So within 3 to 5 days, the fever is very high, and also patient having pain. Do not hesitate to suspect bacterial pneumonias. So once there is pneumonia, you do an x-ray, see along with pneumonia there is fluid, immediately drain the fluid and send it for analysis. Once you send it for analysis, you can also send it for culture to see which type of bacteria is affecting this, and you treat accordingly. You give IV antibiotics. So bacterial infection is taken care of. What about other group? What are the non-infectious group? In the non-infectious group, you have malignancy, which also looks similar like a infectious group, but only thing is you can see malignant cells inside the fluid. And the other non-infectious group, like people having cardiac disease. For example, your heart is functioning at only 40% or less than 60%, which is normally required. Then you can see fluid accumulating in both the lungs. Similarly, kidney patients who are on dialysis, you can see fluid accumulating in the both the lungs. And similarly, liver patients who have liver failure, you can see due to the low protein inside the body, fluid gets accumulated in both the lungs. Once the fluid is non-infective, we know that usually non-infective fluids are seen bilaterally, both the lungs. Usually infective fluids are seen only unilaterally. You can see only one side of the lung affected. So once you know that it is non-infective, you treat the primary cause. In case of cardiac patients, you give cardiac medicines. In kidney patients, dialysis can be done. Similarly, in patients with hypoproteinemia, you can give albumin and increase the protein in the diet. So those things will be covered by giving their appropriate therapy. In case of infectious fluid, once it is tuberculosis, we give you anti-tubercular therapy. In case of bacterial, we give you IV antibiotics, as I mentioned. If it is due to malignancy, if your fluid is showing atypical cells or malignant cells, then we will do a proper workup to see where this fluid come from, where is the primary source of your malignancy, and treat you accordingly. We care about you.